The initial symptoms started in 1996. The telling part was the hill, and that's when I first realised that I've got trouble. It's a tightening in the chest, radiating up into the jaw. It's as if you had toothache sometimes. The symptoms were painful, and it was making me quite depressed as well. You know, I was having tablets for depression.
So yeah, Mum used to be quite active. She used to like going to the Keep Fit classes. She just stopped going because she found it too much. So she stopped doing a lot of stuff.
So the symptoms of angina affected Jean's daily life in many ways. You can't go out for a walk without getting pain. You can't go upstairs, you can't walk up hills. So it's a very debilitating condition, having chest pain.
She was having extreme difficulties walking uphill. She had to stop, take angina spray, GTN spray. It was affecting her life.
So there's a whole combination of medicines that are used that we typically use for patients with angina, and she had been on a lot of these medicines at increasing doses. And it was the fact that she was no longer responding to the medication that made us think about this new treatment.
When Dr. Hill suggested that I had the sinus reducer, well, I more or less jumped at it. You know, thought of not having any medication and not having any angina seemed like a good idea to me. My biggest concern about having this procedure done was my age, because I think I was 79, I was going to be 80 in a few months.
So the reducer starts acting when the device itself has been completely relined with the body's own cells. When it first goes in, because it is a meshwork, then blood can flow through the meshwork without any narrowing. But as the egg timer shape of the device becomes covered with your own cells, then the narrowing actually then comes into play. And so that process takes around 6 to 12 weeks. So it's really the reverse of doing an angioplasty, where you're treating a narrowing on the inflow, you're actually putting a narrowing on the outflow.
I went into the operating theatre and Michelle was there, the nurse, and she squeezed my hand and made me feel a lot better. And they sort of cover you over and turn you on your side and ask you to keep very still.
The procedure itself involves positioning of a tube within the vein in the neck, and we do that using ultrasound. Then the next part of the procedure is to put a wire through that tube into the coronary sinus. Now once that wire's in position, we can take some pictures of the coronary sinus, we can plan where we're going to put the device, and we simply put a guide catheter into the sinus, and we deliver the device, and that's done under local anaesthetic, and I give people a little bit of sedation as well. The procedure from start to finish can be done in under 30 minutes. So it's a straightforward, low-risk procedure.
So following the procedure, Jean was taken to the day case unit. She had a bed rest for about an hour, and a little dressing was put on the side of her neck.
I rang up and everything was fine. The procedure didn't take that long, I was quite surprised.
Helen bought me some dinner in bed. I didn't have any bad effects whatsoever. Before the reducer, I was having a lot of trouble getting the garden done. I can dig the garden now, I couldn't do it before. If I want to go out, it doesn't take me half an hour to get out of the house and up the hill. So consequently, I think more about going out and I enjoy it more. My life is a lot more social now, you know, and that stops you from being depressed. You're getting out more. And I'm just glad that I had it done. And I would advise anybody else that's got really bad angina, if they're offered it, to take it.